afternoon, class. Okay, so today we are going to be doing a procedure called neonatal resuscitation, and my name is Ms. Mushindo. I'll be taking you through this very procedure. So neonatal resuscitation is a procedure that we do on babies who cannot breathe well after delivery. So this is a medical procedure that is an emergency. You have to do it quickly, within 10 minutes you have to be done. So basically we are doing it on babies who cannot initiate and sustain their own breathing. Okay, so there are a few things that we need to know before we proceed. We have what we call as APGAR score. Okay, so I've written on the board, we have the A standing for appearance, the P for the pulse, the G for the grimace, A for activity, R for respirations. Okay, so we are going to assess the APGAR score at 1 minute. The next time we are assessing it is at 5 minutes, and the last, which is the third, is at 10 minutes. Okay, so if we look at that time frame, it's within that period when you're supposed to do this procedure for resuscitation. So on the appearance, the normal appearance of the baby should be pink. The baby should appear pink in color. If the baby looks blue, we know that it's lacking oxygen, it's cyanosed. Then we have the pulse rate. So for the pulse rate, we are going to get the apical pulse, which is gotten from the apex of the heart, so we use a stethoscope. Then on the grimace, we are basically focusing on the reflexes of the baby. Is the baby responding, or it's the baby is just limp? Then we have A for activity. We are going to look at how the muscle tone of the baby is. Is this baby looking flat and floppy, just soft? Is it not flexing its arms or its legs? Then on the respirations, we are counting the rising and the falling of the chest of this baby. Okay, so there are also some few things we need to put together before resuscitating the baby. So we need to ensure that we have a warm surface. Now on the warm surface, we are using a machine that we call a resuscitator. So unfortunately we don't have one, so this table here will act as our warm surface. So it has an overhead heater, and it also has a timer where we are able to set our time so that we know that we are moving at 1 minute, we are moving at 5 minutes, we are also moving at 10 minutes as we are resuscitating the baby. Then we need we need suction apparatus and also resuscitative equipment that can help us as we are doing this procedure. So we may need an oxygen cylinder or an oxygen concentrator, a suction machine, and then we may also need an intubation set so that we are able to intubate the baby if we are not able to achieve the desired respirations before the 10 minutes elapses. So ensure that you place the baby on a warm surface. That's where we are going to do the procedure from. And at all costs, ensure to keep the baby warm throughout the entire procedure, because this baby already has problems with breathing, so we don't want to expose the baby to low temperature, which will cause hypothermia. Okay, so this is it, and remember, once we clock 8 minutes into doing this procedure, we expect that cerebral anoxia has started taking place. So when we talk of anoxia, we are talking of reduced oxygen supply to the brain tissue, and if the oxygen supply is not sustained on the brain tissue, it will cause brain damage, which could cause disabilities in this newborn baby. So we should also take note that there are some drugs that we can give to this baby as we are resuscitating. So we have one drug that we can give, which is Narcan. So Narcan, the dosage is 0.01 milligrams per kg body weight. So meaning the kg body weight of the baby. Then we also have drugs like sodium bicarbonate in case there is metabolic acidosis. It's also given. So this one usually it's given at 1 ml per kg body weight of the baby. So having explained that, I'm going to go ahead and do the actual procedure. So I'll need someone on standby to be my assistant. Then I'll also need a mother. Okay. So I'll request you to be Jessica. I'll request you to be the mother. You can swap seats since you are near to the surface where the baby is. Thank you. Okay. So now, on the requirements, just before we go into the procedure, I have a penguin sucker. This one, we'll use it for suctioning the mouth and also the nostrils of the baby. I have clean masks for the baby, different sizes. Then I also have a stethoscope so that I should be able to check the heartbeat pulse. Then I have an angio bag for the baby. Then I also have a galley pot with normal saline so that I'm going to use it to rinse out the penguin sucker. Then on the bottom shelf I have a receiver for used gloves and other dirty articles. I have a baby hat or a head sock. Then I also have a baby blanket. I also have my clean gloves. So always remember to don your gloves when you're doing this procedure, since this baby has just been delivered. Okay, so as you are starting the procedure, call for help or ask for help so that someone is able to help you with whatever you need. So I'll wash my hands. Okay, so as a midwife, you have discovered that the baby is not breathing well. So you call for help. You call for help as you start your procedure. Help, neonatal resuscitation, or you can say help, baby not breathing well. So I'll quickly come to my table where the baby is. This is a warm surface. I'll also set my timer so that I know the time that I'm working with. So first things first, I'll quickly wipe the baby. So as I'm wiping the baby, this is also stimulating the baby. Okay, so I'll wipe the baby and remove the wet towel, put the baby in a warm blanket or warm towel. Okay, so I'll cover the baby. I don't want to expose the baby to extreme cold. Then I'll put the baby hat on the head of the baby and socks on the feet. Okay, this is also to help keep the baby warm. So now my baby is all covered. So I'll turn the baby so that the head is near to my body, or since the head is where the airway is, where we're going to do most of our procedure from, so it will be closer to the person who is doing the procedure, so as to also help with the maneuvers that we are going to do. So first things first, I'll expose the head and also the chest of the baby. Because we are working with this, I will not expose the entire baby. Okay, so I will assess how is the appearance of my baby. My baby is still looking blue. The rising and the falling of the chest or the respirations are still below 30 breaths per minute. Then I'll assess for the muscle tone and the grimace or the activity. So the baby is still limp. So I'll go ahead and suction. Quickly, I'll suction the mouth. So when you're suctioning, you're going to squeeze the penguin sucker and put it in the mouth. Then let go for it to suck the secretions that are there. So once you have suctioned, you are going to rinse in the normal saline. So depending on the amount of secretions, you go again in the nose, you squeeze and suction. So at least you go about 2 to 3 centimeters in the nostrils. So I'll suction the other nostril. Okay, so you squeeze and put in the nostril, let go. I'll rinse my penguin sucker. Okay, so since this one is dirty now, we have suctioned, everything is out. I'm going to assess again. How is the appearance of the baby? The baby is still looking blue. The respirations are still lower than 30 breaths per minute. Then I'll check my pulse. I'll just check the pulse of the baby. Okay. So we have a timer on the resuscitator. I'll check the pulse, apical pulse. The pulse is still below 100 beats per minute. So I'll go ahead and do the ventilations. So I'll choose a mask that is suitable for the size of the baby's face. It should cover the mouth, the nose, and also the chin, so that I can be able to give the rescue breath. Are you able to see the chest of the baby? Okay, so this side they cannot see. So allow me to expose the baby a bit so that we are able to see. When you are doing this procedure on a baby, please don't expose the whole body. So I'm doing it for learning purposes so that people can be able to see this side. Okay, so you're going to tilt the head of the baby or hyperextend it like this. Put your mask, it should cover the mouth and the nostrils. Then you're going to make a seal. Okay. Ensure that you don't press on the eyes of the baby. And don't press too hard as you have put your mask. So you're going to try the arm you back. You do 2 to 3 puffs to see if it's working. So 1, 2, 3. Okay, so of course my baby is going to breathe. But then we have to continue the procedure. In case the baby does not breathe, you are going to give now 5 rescue breaths. Okay. So I'll do 5. 1. Okay. 1, 2, 3, 4, 5. So after this, I'm going to quickly assess the baby again. How is the appearance of the baby? The baby is still blue. How is how are the respirations? The respirations are still below 30 breaths per minute. Then I'll check the pulse. Okay, under a minute, apical pulse still below 100 beats per minute. Then I'll check the grimace and also the activity or muscle tone of this baby. The baby is still limp. So again, I'll quickly assess. Check if you have positioned the baby well. Check if you have positioned the mask well on the baby, as you are ready now to give 15 ventilations on this baby. So you are giving it in 30 seconds, 1 ventilation per 2 seconds. So you are going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, so we've done 15. And still, when you let go or when you stop and be bagging, you find that this baby is still not able to sustain the respirations after inflating the lungs. So you are going to go ahead and assess again. Don't forget to assess. How is the appearance of the baby? How is the color? The baby is still looking blue. How is the muscle tone and the grimace? The baby is still not able to do the flexing, and also the muscle tone is poor. So you will check the pulse. Okay, apical pulse still less than 100 beats per minute. Rising and falling of the chest still less than 30 breaths per minute. So now I will continue with my ventilations. So now I'm going to do 40 ventilations in a minute. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40. Okay, so you will quickly assess and check again how is the baby's appearance. So my assistant, I hope you're on standby because this is the next phase where I need you to come. So I'll check the appearance of the baby. Okay, the baby is still looking blue. The rising and falling of the chest is still below 30 breaths per minute. I'll assess the apical pulse. Check the pulse of the baby. Okay, so the pulse of this baby is still below 100 beats per minute. Remember, we have a timer that is going to alert us every time when we need to assess. Then I'll check for the grimace and muscle tone on the upper limbs and lower limbs. This baby is still looking limp. So the next step now, I'm going to do 3 cardiac compressions against 1 ventilation. Okay, so we are going to do the cardiac compressions even just using a thumb on the sternum. So you are going to also check, is there severe chest indrawing or chest indrawing that is observed on this baby. So I'll start with my cardiac compressions. I'll do 1, 2, 3. Then I'll go with 1 ventilation. Again, 1, 2, 3. Then I'll go with 1 ventilation. Again, 1, 2, 3. I'll go with another ventilation. So now when you are doing this, you also check your time. Once it's 1 minute, you are going to stop. So you check this baby, check the appearance of the baby. Okay, the baby is looking blue, and also the baby is still not responding. It's still looking limp. and the rising and falling of the chest is still below 30 breaths per minute. You check also the apical pulse. Check the apical pulse. Okay, so it's still below 100 beats per minute. So what do you do next when you see that the baby is not responding? You can ask now the assistant also, who is part of the team, to check the history of the mother. If the mother was given any of the following drugs, morphine or pethidine, in the previous 4 to 6 hours during labor, you expect that this baby will come with the asphyxia. So you're going to give Narcan, which we said is 0.01 milligrams per kg body weight, which acts as an antidote for morphine and pethidine. So now, since we had done our ventilations and we could see that our baby was breathing, right? When I was doing the ventilations, were we seeing the baby breathing?
Yes.
Yes. So suppose we ended the procedure just there when the baby was breathing after the ventilations, and the baby was the respirations were sustained and the pulse rate was good, which is above 100. So we are going to give the baby to the mother so that she puts the baby on her chest, skin to skin contact, the way we do kangaroo care. Yes, skin to skin contact, so that she continues with keeping the baby warm. Then in a case where the baby unfortunately doesn't manage to sustain the respirations, the airway is still blocked, we are going to take the baby to the neonatal intensive care unit or the special care baby unit to ensure that they continue with the management. So I'll go to the mother. Our baby is alive and the baby is able to breathe. So, Madam Jessica, here is your baby. We're going to put the baby on your chest, skin to skin, and cover the baby. So, we will not just end here. We need to ensure that we monitor the baby at least for the first 6 hours. We keep checking the APGAR score to ensure that our baby is recovering. So, one thing that you also need to know is, as you start doing the procedure after calling for help, you need to reassure the mother. Reassure the mother that you are doing all you can to ensure that the baby is breathing and also faring well. Don't forget to reassure the mother, because she'll be very anxious to say, what is going on? Why are they doing this to the baby? So to prevent all that anxiety and disturbance, ensure that you reassure the mother, and also give her the baby. In case you successfully do the resuscitation, give her the baby so that she can also initiate breastfeeding. That is part of what you can tell her, apart from putting the baby in skin to skin contact to keep the baby warm. She can also initiate breastfeeding once the baby stabilizes. Okay, so after doing all this, after giving the baby to the mother, I'm going to clear away all the equipment that I have used. I'll go now to the sluice room, discard all these secretions that are in this galley pot, and then decontaminate everything that I have used, clean the trolley, pack it where it's supposed to be. Then obviously I'm going to doff the gloves and wash my hands. Wash my hands, dry them, and document. After documentation, I'll report to my supervisor on how the procedure was done and the end result or the expectations, or whatever we have found at the end. If we have referred the baby, or the baby has been kept in and is being taken care of by the mother through kangaroo care. So this is how we do neonatal resuscitation. This is the end of the procedure. Thank you.